Today we know a lot about how to keep babies safe from SIDS and suffocation deaths. Sudden infant death syndrome, or SIDS, is the sudden death of an infant less than a year old without a known cause. Because SIDS occurs while the baby is asleep, it has also been called crib death, but more babies die outside of a crib than in a crib. In addition, many other babies die from accidents while they're asleep, from suffocation or from strangulation. Every year, about 4,000 babies die in the U.S. while they're sleeping. 90% of these babies die before they're 6 months old. It's sometimes hard to know if a baby dies from SIDS or from suffocation. The most important thing for you to know, though, is that you can keep your baby safe from SIDS and suffocation if you follow the same safe sleep guidelines.
My son Darius, he died, and we did sleep in the same, we co-slept. I got up and I remember looking and seeing that, something is different about this. It's too still, it's too quiet, it's too calm. And then I became a part of this group that nobody wants membership to.
He was a colicky baby, so I laid him on his tummy because someone once told me that babies sleep more soundly that way. I had great prenatal care, didn't smoke during my pregnancy. SIDS is so rare, I felt like I was untouchable. I just didn't think it could happen to my kid or me.
Never take those shortcuts, always go the extra mile. It'll pay off in the long run.
Today it's really hard caring for a new baby. You're busy, you're tired, you hear advice everywhere you turn. The most important thing you can take in and absorb is today's medical information, today's facts and statistics. The knowledge now surrounding safe sleep has dramatically decreased the number of babies who die while they're sleeping. Today's baby is here to help you.
Proper sleeping habits for infants should be something that we campaign and talk about.
It'll prevent you from making those last-minute desperate decisions to fall asleep with your baby or to place your baby on their tummy just to get 30 minutes of sleep. You don't want to buy yourself 30 minutes of sleep. You want to buy yourself a lifetime of memories with your child.
Today, a group of medical professionals have made it easier for you. We've done the research. We're here to help you make the best choices for your baby, for today's baby.
It's not worth it to have beautiful bedding. It's not worth it to sleep in bed with your child, to share those bonding moments, because it's all the moments that follow that are the important ones.
Today, babies who sleep on their backs breathe better. Many parents ask why stomach sleeping is not safe. Remember that everyone breathes in oxygen and breathes out carbon dioxide. When babies sleep on their stomachs, the carbon dioxide that they have breathed out can build up around their face. Instead of breathing fresh air with oxygen, the baby rebreathes the air that they have just breathed out. This exhaled air does not have enough oxygen. The baby's oxygen level can get too low and their carbon dioxide level too high. If this happens, some babies will wake enough to move around so that there is fresh air around their face. However, researchers believe that babies die of SIDS if they can't wake up to react to these abnormal oxygen and carbon dioxide levels. When babies sleep on their stomach, they sleep more soundly. So if they get their face down and have a problem with their oxygen or carbon dioxide level, they may not be able to wake up and save themselves. Babies who sleep on their backs are less likely to get into this problem with abnormal oxygen and carbon dioxide.
Today, babies won't choke when they're on their backs. Based on recent studies, Today's Baby recommends that babies always be placed on their backs when sleeping. Babies who sleep on their stomachs are more likely to die from SIDS or to suffocate. Babies who sleep on their sides are more likely to roll onto their stomachs. Someone may tell you that a baby will choke if he spits up while he's on his back, but that's not true. First of all, humans have a gag reflex that keeps us from choking. If you hear your baby gagging, it doesn't mean that he's choking. It means that he's protecting himself from choking. In addition, our bodies are designed so that it is harder to breathe food into the lungs while we're lying on our backs than when we are lying on our stomachs. Here is a diagram of a baby who is sleeping on the stomach. You'll see that the esophagus, or the food pipe, is above the trachea, or windpipe. If this baby spits up, it is easy for the food to go down into the lungs. If your baby is on the back, the food has to go up against gravity to go down the windpipe and cause choking. So sleeping on the back will protect your baby from SIDS, suffocation, and choking.
Today, your baby should sleep in your room in a crib or bassinet. The safest place for your baby to sleep is in your room, but in a separate sleeping space. It's nice to cuddle with your baby in your bed, but when it's time for you to go to sleep, you should always place your baby in his or her own separate space. Today's Baby recommends a crib that meets current safety standards, or a play yard or portable crib with mesh sides. This is a nice choice because it's portable and small, and you can easily move it if you have to. It also costs less than a crib. Bassinets work too, but stay away from the ones that have soft or fluffy sides. Bassinets can be used only until the baby is about 2 months old. If you're using a hand-me-down crib, you'll want it to have all of the original pieces and no missing or broken pieces. You should not be able to drop the sides of the crib. Also, make sure that the slats are evenly spaced. You should not be able to fit a soda can in between the slats. That is so the baby's head or body cannot slip between the slats.
Today, share your room but not your bed with your baby. Although many parents will sleep with their babies because they think that it's a good way to keep an eye on them and make sure that they're safe, this is actually very dangerous for your baby. Studies have shown that sharing a room with your baby but not sleeping in the same bed is the safest way to protect against SIDS and accidental deaths. Remember how we talked about the importance of a firm mattress with nothing but the baby in the crib? Think about your bed. Although it may be comfortable for you, it may not be safe for your baby. You probably have pillows and blankets. These can move as you sleep, or the baby can move and get tangled up in these or pressed against them and suffocate. You also probably have a softer mattress than what the baby should sleep on. Your baby's head can sink down into the mattress, and that can make it harder to get enough oxygen. In addition, babies can slip into the crack between the mattress and the bed frame or the wall and become trapped and suffocate. Today's Baby recommends that you have the baby in his own crib or bassinet in your room. This will allow you to keep a close eye on him while he's sleeping, make it easy for you to feed, change, and check on him, and keep blankets and pillows away from him.
Today, a bare crib is really the best. You may not believe it if you have ever been to a store that sells cribs or baby merchandise. But today's Baby is telling you the truth. The only bedding that you need in your crib is a tight-fitting sheet under the baby. If you want to use a waterproof pad under the sheet, that is fine, so long as it is thin. If blankets are loose in the crib, they can cover your baby's face and increase the risk of SIDS and accidental suffocation. They can also get wrapped around your baby's body or neck. There shouldn't be any pillows or cushions in the crib. And bumper pads can be dangerous too. The baby can roll into any of these objects and not be able to roll back away from the pillow or bumper pad. So none of that should be in the crib. The only thing other than the firm mattress with a tight-fitting sheet that should be in the crib is your baby. Remember, a bare crib is best. If you're worried that your baby will get cold, you can use a wearable blanket or sleeper clothing. You can also layer clothing on your baby. This will keep your baby warm and safe.
Today, you can feed your baby in bed, but place baby in crib when you're ready to go to sleep.
We did sleep in the same, we co-slept. I got up and I remember looking and seeing that, something is different about this. It's too still, it's too quiet, it's too calm. And then I became a part of this group. That nobody wants membership to.
We know that you want to spend quality time with your baby. If you want to cuddle with your baby or feed your baby in your bed, that is absolutely fine. However, when you're finished cuddling and feeding, or you're ready to go back to sleep, remember to place your baby back into the crib. Don't feed your baby on a couch, sofa, or armchair if you think that you are tired enough that you might fall asleep there. That can be very dangerous for your baby because it is a tight space and suffocation is more likely to happen. Even the most vigilant mothers may fall asleep while feeding their babies while in bed. Don't panic. Just put the baby back in her crib as soon as you wake and realize what happened.
Today, pacifiers protect your baby from SIDS. A pacifier is a great way to help you soothe today's baby. Studies have shown that using a pacifier can also help to protect your baby from SIDS. We're not sure how it works, but we think that there's something about using a pacifier that may change how a baby sleeps and wakes up. If you're breastfeeding, you should wait until both you and your baby are comfortable with the breastfeeding routine. This usually takes 2 to 4 weeks, depending on the baby and the mom. Once this happens, you don't need to worry about nipple confusion or the pacifier interfering with the breastfeeding. If you're not breastfeeding, you can start a pacifier in the first week. Make sure that the pacifier is clean and use it only for sleep time and nap time. If the pacifier falls out after your baby falls asleep, you don't have to put it back in. If your baby doesn't want a pacifier, don't force it. You can just try again at a later time. Today, healthy babies should wake up easily and often. Since doctors began recommending that babies sleep on their backs, the number of babies that have died has dropped in half. So why do some parents still put their babies on their stomachs?
He was always the baby that got up several times a night, but that night in particular, he got up even more. So around 6 o'clock in the morning, he woke up. I gave him some medicine, and I put him in his bed, in his crib. And this is the first time I did it, but I put him in there exhausted, frustrated, and I closed the door and left the crib, or left the nursery, and I thought, I just have to sleep. I'm so tired. He's got to sleep. He has to cry it out. And I shut the door on him. Since I didn't hear him around 8 o'clock in the morning, I went to check on him. I opened the door to his nursery, and immediately I saw that he was in what looked like a compromising position. And he was so cold. And he was so stiff.
Stomach sleepers sleep longer and more deeply. And if the baby sleeps longer, the parent gets to sleep longer. In fact, many people describe a good sleeper as a baby who sleeps all night long. However, remember that the good sleepers, babies who sleep more deeply, also are not going to wake up easily. We think that this is why stomach sleepers are more likely to die of SIDS. Remember that babies need to be able to wake up quickly and easily. This helps to protect them if they are having trouble getting oxygen, for instance. So when babies are on their stomachs, not waking up so easily may be a problem. We want babies to wake up easily and often for at least the first 6 months. That's what we call a good sleeper. It is not normal for a baby in the first few months to sleep through the night. That can be dangerous. Believe it or not, being a light sleeper means that your baby is normal, healthy, and better protected from SIDS.
Today, bed sharing is especially dangerous under certain circumstances. Today's baby recommends that you never sleep with your baby. For babies who are younger than 3 months old, there is a 5 times higher chance of dying from SIDS if they are bed sharing, even with non-smoking parents. We want you to know about the other bed sharing situations that are especially dangerous. But no one should sleep with the baby, and this includes parents, siblings, other adults, and even twins. Remember that babies are not strong. They cannot push away from another person or body part that may be too close or lying across their face or chest. The same holds true for pets. Do not let your pets sleep with your baby. Don't sleep with your baby in a bed if you or your partner is a smoker, even if you're not smoking in the bed. The chances of death are as high as 45 to 65 times higher if one or both of the parents smoke, depending on the age of the baby. Don't sleep with your baby in a bed if you or your partner has had any alcohol, is taking medications, or is using illegal drugs. All of these can make you sleep more deeply. You may not be aware of your baby or what your own body is doing while you're asleep. Don't sleep with your baby if she is younger than 3 months old. Her sleep pattern may not have matured yet, and she may have more difficulty waking up easily.
Today, there are ways to help your baby sleep comfortably on the back. Most babies who begin sleeping on their backs are very comfortable in that position. However, some parents worry that the baby doesn't seem comfortable because she wakes frequently or startles herself awake. Remember that waking frequently or startling means that your baby is aware of her surroundings and will be better able to react quickly if she isn't getting enough oxygen. She's not uncomfortable. To help your baby fall asleep more easily on her back, try any of the following. Motion is often soothing. Rock your baby or put her in a swing. It's best if the swing has a reclining seat so that the baby's head cannot fall forward. Make sure that a responsible adult is watching, and remember to fasten the safety strap. Move her to the crib after she falls asleep and lay her on her back. White noise is soothing to babies. This is soft background noise such as a fan, a CD of nature noises or a human heartbeat, or an air conditioner. A pacifier may be soothing. An added benefit is that pacifiers help protect babies from SIDS.
Today, you will hear a lot of different suggestions, but you need to choose what is best for your baby based on the facts. We have been telling you all kinds of ways to keep your baby safe during sleep. But what about advice you may be getting from family and friends? And what about parenting magazines and websites? We know that you are bombarded by advice, and it may be different from what you've heard from today's baby. You don't want to hurt the feelings of people you love if they're telling you to do something different. Rest assured that today's baby is giving you the latest information based on sound research. Our goal is to save lives and tell it to you straight. If someone is telling you to do something because they did it and it worked fine, or they're lucky. Feel free to share these videos with your loved ones so they can learn the latest and understand your reasons behind your choices.
We thank you for your participation and thank you for working hard to keep your baby safe. Just as a reminder, here are the key messages. Back to sleep for every sleep. This means bedtime and nap time. Remember to put your baby only on a firm mattress to sleep. There should be nothing in the crib except for your baby. No pillows, blankets, or bumper pads. Room share with your baby, but don't share your bed with your baby. Room sharing is the safest for your baby. Use a pacifier for your baby at nap time and at bedtime. Today, we thank you for your participation and thank you for working hard to keep your baby safe.